What part of the government's position re India are you most uncomfortable with?
Well, I haven't, I suppose, thought about it in those terms, Peter, but I was against the ban overall last week. Obviously, the announcement of jail time has elevated the issue and created a reaction within the Australian Indian community. But even last week, I mean, I think we should be trying to help Australians in distress. It's obviously a distressing situation. Yes, there would be risk to us bringing Australians home from India, but isn't that when you're proven who you care about and what you care about? It's when you have to make a sacrifice, when you potentially have to put yourself at risk to help others. That's what shows that we really are Australian, we really do care for each other and help out our brothers and sisters in need. And so that's why I know the public health advice is there and I understand why the public health officials want to reduce the risk to zero, but I don't want to get rid of all our brotherly love for other Australians just to reduce our risk of coronavirus to nothing.
Well, I mean, you mentioned that there, but this was part of Paul Kelly's letter last week. He says each new case identified in quarantine increases the risk of leakage into the Australian community through transmission to workers, other returnees, subsequently into the Australian community more broadly. And that would come at a huge cost if that were to happen.
Absolutely it would, Peter. But what if you were over there? What if it was your wife or brother or son stranded in another country? You're an Australian, you have an Australian citizenship, your passport says you're allowed to come and go freely in this country. And no one's saying that, of course, people could come back and walk down the street. They'd have to go into appropriate quarantine. Perhaps we could establish some more specific and protected quarantine for cases from India, given the risk. But I worry here, mate. We've effectively had the takeover of our country by the public health bureaucracy, and we've allowed ourselves to get so focused on one particular issue that we're starting to lose our humanity on other problems. There are other things in life that's important than just dealing with this global pandemic. And treating our fellow Australians, helping our fellow Australians is one of the most important things we should do as fellow citizens of this country.
Well, who's calling the shots too? I mean, does that concern you when the government says it's following the health advice, and then you got Paul Kelly saying, well, no, that wasn't me who said that. So no one seems to be owning up to who's making the shots here, who's calling the shots.
I mean, look, I haven't been involved in all the discussions, Peter, so I can't be an umpire here. It seems to me that there's just a bit of a miscommunication that obviously Paul Kelly hasn't set the penalties in the Biosecurity Act. That's a responsibility of Parliament. The jail time and fines are set there in that Act. But Paul is obviously, or Mr. Kelly's provided advice here on the risks. And
but he did say that Biosecurity Act should be activated.
He's providing advice from one perspective. But we should also, as I say, take into account a whole range of perspectives, which does surely include helping out fellow Australians in need. And I've spoken to a lot of people in the Australian Indian community over the past 24 hours. I've got to know a lot of great people from that community over the years. They do feel isolated, they do feel deserted, and that pains me greatly. I think we now need to do all we can to restore that trust and help our fellow Australians.
Yeah, I mean, Paul Kelly did suggest in that letter last week that the Biosecurity Act should be activated.
Yeah, well, that's his advice. As I said, I haven't been involved in all of those discussions, and I'm not here to dispute his medical opinion or advice. I'm just saying that when you go to make serious decisions such as locking Australians out of their own country, a whole different range of perspectives should be brought to bear, not just purely the technical and medical ones.
Well, one of the Australians who's stranded at the moment in the Maldives, as a matter of fact, but it's the former opener, Michael Slater. He reckons the Prime Minister's got blood on his hands. But what do you make of those comments?
Oh, look, I can understand the emotional reaction people would have that find themselves in those circumstances. I don't agree with Michael's assessment here. We are having differences of opinion about judgments, about risk and consequences. I mean, it was put to me yesterday that is this an example of racism? And I definitely don't think that's the case. I understand why people have that reaction, but I suppose I coined a term that perhaps this is an example of perfectism. We're trying to make everything perfect here. We're trying to make our response to coronavirus perfect. And in doing so, we are losing sight of other important issues. And I fear here we're falling into the trap of making the perfect the enemy of the good. Our quarantine system's not perfect. No one's saying it is, but nothing will ever be perfect. And there are a wide range of things we have to do in life, apart from just focusing on one issue. And when you do sometimes just focus on one thing, you tend to drop the ball on other matters that are equally important.
The PM says this morning that those flights will more than likely resume on the 15th of May. I mean, you would be pleased with that, but he says it's not going to happen before then because the caseload at the moment is just too high.
Look, that's not the whole thing, the totality of what I saw from the Prime Minister's comments yesterday. I think it's a good thing the Prime Minister mentioned it will be under review constantly. He said it would be under review even before potentially the end of the 2-week period. Obviously, that will be dependent on data and information. So, look, I welcome that. From my perspective, I'd love to see the restrictions removed as soon as possible because I like to think that we'd help Australians out as soon as possible. But yes, this is a temporary measure. As I say, though, I was against it last week. I just don't. I mean, I don't like this precedent that we're locking Australians out of their own country. We've gone a long way from a year ago, Peter. There's a lot of water has travelled under the bridge. When a year ago, or just over a year ago, we sent planes to Wuhan to bring Australians back. And that was at a time when we probably feared more about the coronavirus. We didn't really know about it. We had no quarantine system established. Yet we did that then. And then now, we just put the walls up and say it's too hard. I don't like that trend, and I hope it stops and we go back to caring for other Australians and helping them out.
Okay, Senator, we're out of time. Appreciate your time as always, though. Have you had a good steak at Beef Week?
Get up here to Beef Week, Peter.
Have you had a good steak yet?
Mate, I reckon I had about 5 or 6 steaks last night. I had 3 functions last night and a 3-course steak meal at lunch. So,
okay.
But yeah, I'm going to test the hypothesis. Can you eat too much beef?
Yeah, no, your iron levels will be absolutely peaking. Fantastic. Good to see you. Matt Canavan, good to have you with us as always. We'll talk to you soon.